The Blacklist. 13. Remedies that are quietly destroying your liver. Have you ever stopped to think about the amount of substances your liver needs to process every day? Medications, supplements, processed foods, and even toxins present in the environment pass through this essential organ. But what happens when he can't take it anymore? Liver damage may be silent at first, but over time, signs appear, and it's often too late. Certain medications, even those considered safe, can put a strain on the liver and lead to serious complications. And the worst, many people use these drugs daily without knowing the risks. In this video, you will find out which are the 13 most dangerous drugs for your liver and how to identify the first warning signs. Remedy number 10 is the most shocking, and few people know about it. Let's get started. Your body gives signals. Recognize early symptoms of liver damage before it's too late. The liver is one of the most resilient organs in the human body, but when it starts to fail, the signs can be subtle and easily ignored. Liver damage often develops silently, and by the time symptoms become evident, the liver may already be severely compromised. One of the first warning signs is extreme fatigue. Do you feel constant tiredness even though you sleep well? This may be an indication that your liver is not working properly. Another common symptom is pain or discomfort in the upper right part of the abdomen. This pain may be mild at first, but over time, it becomes persistent and intense. Changes in digestion are also a warning. If you start to experience frequent nausea, loss of appetite, or abdominal bloating for no apparent reason, it may be that your liver is having difficulty processing the substances that enter your body. Jaundice, which manifests itself by yellowing of the skin and eyes, is one of the most obvious signs that something is wrong. This happens when the liver cannot properly eliminate bilirubin, resulting in the accumulation of this substance in the blood. Another worrying symptom is dark urine and whitish stools. If your urine is very yellowish, similar to the color of black tea, or your stools are too pale, this may indicate a liver problem. In addition, intense itching of the skin, swelling in the legs, and accumulation of fluids in the abdomen are warning signs of advanced liver damage. If you notice any of these symptoms, see a doctor immediately. The sooner the problem is detected, the greater the chances of liver recovery without the need for invasive treatments. How soon can your liver be compromised by medications? The answer may surprise you. Many people believe that liver damage only occurs after years of medication use, but the truth is that in some cases, liver impairment can appear within a few days or weeks. This depends on several factors, such as individual sensitivity, the dosage of the drug, the duration of use, and the presence of other conditions, such as pre-existing liver diseases or frequent alcohol consumption. Some medications can cause acute liver damage, leading to drug hepatitis in less than a month. Others can cause progressive damage, slowly affecting liver cells until symptoms appear. Therefore, many people only notice the problem when it is already advanced. For example, antibiotics such as Isoniazid can cause inflammation in the liver in the first few weeks of treatment. Methotrexate, used to treat arthritis and some cancers, can take months or years to significantly compromise the liver. The main way to detect this damage early is through blood tests that evaluate liver enzymes. If the levels of these enzymes are elevated, it may be a sign that the liver is suffering. Unfortunately, many people only get these tests when they already have severe symptoms, such as jaundice, extreme fatigue, or abdominal bloating. Most worryingly, there is not always a fixed pattern of time for damage to arise. While some people can use certain medications for years without side effects, others can develop liver failure within a few months. Therefore, it is essential to have medical monitoring when using any medication for prolonged periods and never exceed the recommended doses. Your liver doesn't warn you in advance when it's overloaded, so prevention is always the best choice. Care. You should never stop your medicine without medical advice. Upon discovering that certain medications can harm the liver, many people may think about stopping their use immediately. But this can be a dangerous decision. Many of the medications that can cause liver damage are essential for treating serious illnesses such as hypertension, diabetes, infections, and psychiatric disorders. Stopping taking them without medical advice can lead to serious consequences, such as hypertensive crises, uncontrolled infections, psychiatric breakdowns, and even life-threatening events. The secret is not to avoid these medications completely, but to use them correctly and under medical supervision. If you need to take a medicine that can affect your liver, your doctor may order periodic tests to monitor liver function. If there are signs of damage, he may adjust the dose or replace the medication with a safer alternative. In addition, there are some measures that can help minimize the risks. Avoiding alcohol consumption during treatment is essential, as alcohol potentiates liver damage and can accelerate the development of liver problems. Another important strategy is not to combine different medications without medical advice. Many substances interact with each other, increasing liver toxicity without the patient realizing it. If you already have a history of liver problems, such as hepatitis or fatty liver, it is even more important to inform your doctor before starting any drug treatment. The liver has an incredible ability to regenerate, but it is not invincible. Using medications consciously, respecting the recommended doses, and having regular medical follow-up is the best way to protect your health without compromising your treatment. Never make medical decisions alone. If you have questions about any medication, talk to a health professional before making any changes. The BLACKLIST. The 13 drugs that may be harming your liver without you realizing it. Many medications are widely used and seem harmless, but they may be quietly taxing your liver. Some of them are prescribed to treat infections, heart problems, inflammation, and even psychiatric conditions. Others are sold over the counter and consumed indiscriminately, further increasing the risk of liver damage. But what do they all have in common? They require the liver to work harder than it should to process them, eliminating toxic substances that, when accumulated, can lead to inflammation, drug hepatitis, and, in extreme cases, liver failure. Symptoms don't always appear immediately. Often, the liver suffers in silence until the problem is advanced. And by the time signs start to emerge, such as extreme fatigue, jaundice, or abdominal pain, it may be too late to reverse the damage without more aggressive treatment. The good news is that by knowing the most dangerous medications for the liver, you can avoid overuse and take precautions to protect your health. Over the next few topics, you'll find out what these 13 medications are and understand why they can be so harmful. The last on the list is the most worrying, and many people take it regularly without imagining the risks. So, keep following and see if you have already taken any of these medications without proper care. If so, it's time to be aware and talk to your doctor to evaluate safer alternatives. Your liver is a vital organ and deserves attention. Now, let's reveal the 13 drugs that could be destroying your liver without you even realizing it. 13th, statins, the cholesterol drugs that can overwhelm the liver. Statins are widely prescribed to lower cholesterol and prevent cardiovascular disease, saving millions of lives. But what many don't know is that these drugs can also cause liver damage, especially when used for long periods or in high doses. Statins work by blocking an enzyme responsible for the production of cholesterol in the liver. However, this process can generate an unwanted side effect: inflammation of liver cells. Prolonged use can lead to increased liver enzymes in the blood, a sign that the liver is suffering. While most patients don't develop serious problems, some may experience symptoms such as extreme fatigue, abdominal pain, and yellowing of the skin and eyes, signs that the liver may be overworked. The risk increases in people who already have a history of liver disease, consume alcohol regularly, or use other medications that affect the liver. Therefore, before starting the use of statins, it is essential to perform liver function tests to ensure that the liver is healthy. And once on treatment, it's critical to monitor these levels regularly. If you already take statins, be on the lookout for symptoms such as severe weakness, abnormal muscle pain, and darkening of the urine, as these can indicate a developing liver problem. Fortunately, for most people, the benefits of statins outweigh the risks. But never ignore your body's signals. If you experience anything unusual, talk to your doctor to assess the need for dose adjustments or replacement with another safer option. High cholesterol can be dangerous, but protecting your liver should also be a priority. And this is just the first on the list. the upcoming medications could be even more harmful than you think. 12th, antiretrovirals, the hidden price of HIV drugs. Antiretrovirals have revolutionized HIV treatment, allowing millions of people to live for decades with the disease under control. However, these medications can bring a worrying side effect: liver damage. The liver is responsible for metabolizing most antiretrovirals, which means that it constantly works to process these substances. Over time, this extra strain can lead to liver inflammation and increased liver enzymes, indicating overload. Among the antiretrovirals most associated with liver damage are efavirenz, ritonavir, and nevirapine. These medications can trigger drug hepatitis in some people, especially those who already have liver problems, such as hepatitis B or C. Initial symptoms may be discrete, such as fatigue and nausea, but in more severe cases, they can progress to jaundice, dark urine, and pain in the right side of the abdomen. In addition, the risk of liver toxicity increases if the patient consumes alcohol regularly or takes other medications that also require intense metabolization by the liver. The good news is that, with proper medical follow-up, it is possible to continue treatment without compromising liver health. Liver function tests should be done regularly to monitor for any changes, and if a problem is identified, the doctor may adjust the dose or switch the medication to a less toxic option. Stopping treatment on your own is never a safe option, as this can lead to resistance of the virus and worsening of the clinical condition. If you use antiretrovirals, always be aware of your body's signals and talk to your doctor about strategies to protect your liver. And beware, because the next drug on the list can cause serious damage to your liver even faster. 11th, Isoniazid, the powerful antibiotic that also threatens your liver. Isoniazid is one of the main antibiotics used in the treatment of tuberculosis, being extremely effective against the bacterium that causes the disease. However, its prolonged use can bring a worrying side effect: liver damage. This drug is metabolized by the liver, and during this process, toxic substances can be produced that attack liver cells. Studies show that up to 20% of patients who use Isoniazid have elevated liver enzymes, a sign that the liver is overworked. In most cases, these levels return to normal over time, but in some people, liver damage can develop into severe drug hepatitis. Symptoms can include intense fatigue, persistent nausea, loss of appetite, dark urine, and even jaundice, characterized by yellowing of the skin and eyes. People over the age of 50, frequent alcohol drinkers, and individuals with pre-existing liver diseases are at higher risk of developing complications. Therefore, when starting treatment with Isoniazid, doctors usually order liver function tests and monitor the patient throughout the period of use of the drug. If there are signs that the liver is suffering, it may be necessary to adjust the dose or even stop the treatment, replacing it with another approach. The problem is that many people don't notice liver damage until symptoms are advanced. If you or someone close to you is being treated with Isoniazid, be on the lookout for any signs of abdominal discomfort, extreme tiredness, or a change in skin and urine color. And remember, never stop using the drug without consulting a doctor. Tuberculosis is a serious disease and needs to be treated correctly, but always with due attention to liver health. Now get ready, because the next drug on the list may be in your cupboard and you can't even imagine the danger. 10th, Diclofenac, the popular anti-inflammatory that hides dangers. Diclofenac is one of the most widely used anti-inflammatory drugs in the world to relieve muscle pain, arthritis, and inflammation. It is found in tablets, ointments, and even injectables, and is considered an affordable and effective drug. But what few know is that this drug can be extremely harmful to the liver. Like other non-steroidal anti-inflammatory drugs, NSAIDs, diclofenac needs to be metabolized by the liver, and this process can generate toxic substances that damage liver cells. Although most people do not have serious problems, some may develop drug hepatitis, which occurs when the liver becomes inflamed due to the toxicity of the drug. Early signs of this problem include severe fatigue, loss of appetite, abdominal pain, and dark urine. In more severe cases, there may be yellowing of the skin and eyes, characterizing jaundice. The biggest danger of Diclofenac is that its effects on the liver can take weeks or months to manifest, and by the time symptoms appear, the injury may already be advanced. People who already have liver disease, consume alcohol regularly, or take other medications that require processing by the liver are more vulnerable to the damage caused by this drug. Another problem is the indiscriminate use of Diclofenac without a medical prescription. Because it is a widely available drug, many people take it uncontrollably, increasing the risk of liver toxicity. If you need to use anti-inflammatory drugs frequently, talk to your doctor to assess the need for liver function tests and the possibility of safer alternatives. Avoiding prolonged use and correctly following medical recommendations is essential to protect your liver. And beware, the next drug on the list is a very common antibiotic, but it can pose serious risks to your liver health. 9th, amoxicillin with clavulanate, the common antibiotic that can attack your liver in silence. Amoxicillin with clavulanate is one of the most prescribed antibiotics in the world. Its use is indicated to treat respiratory, urinary, skin infections, and several other bacterial conditions. Because it is an effective and widely used drug, many people believe that it is completely safe. However, this antibiotic can cause liver damage, especially when used for a long time or without medical supervision. The combination of amoxicillin and clavulanic acid increases the potency of the drug, making it more effective against resistant bacteria. But that same combination also puts a strain on the liver, making it one of the antibiotics most often associated with drug hepatitis. Symptoms of liver damage induced by this antibiotic can appear days or even weeks after starting treatment. Severe fatigue, abdominal pain, nausea, jaundice, and dark urine are warning signs that should not be ignored. In some cases, the inflammation caused by the drug can progress to more severe liver damage, requiring immediate interruption of treatment. The most vulnerable groups include the elderly, people with pre-existing liver diseases, and those who already use other drugs metabolized by the liver. Therefore, it is essential to never use antibiotics without a medical prescription, and to always strictly follow the recommended dose. If you are being treated with amoxicillin and notice any unusual symptoms, see a doctor immediately. The liver has an incredible capacity for regeneration, but if continuously exposed to toxic substances, this recovery can become impossible. And beware, because the next drug on the list is widely used to treat heart problems and can have devastating effects on the liver. 8th, Amiodarone, the heart medicine that requires extra attention. Amiodarone is a drug that is widely used to treat cardiac arrhythmias by helping to control the heartbeat in patients with severe heart problems. Its effectiveness is unquestionable, but this remedy hides a worrying side effect. It can cause serious damage to the liver. Amiodarone-induced liver toxicity occurs because the drug builds up in the liver over time. Unlike other drugs, which are quickly metabolized and eliminated by the body, amiodarone can remain in the body for weeks or even months, increasing the risk of inflammation and liver damage. Many patients who take this medication for a long time develop an increase in liver enzymes, a sign that the liver is overworked. In most cases, this change is mild and reversible, but in some situations, it can progress to drug hepatitis and even liver cirrhosis. Symptoms include severe fatigue, abdominal pain, loss of appetite, dark urine, and yellowing of the skin and eyes. The big problem is that the signs of liver toxicity can take months to appear, which causes many people to continue using the drug without realizing that the liver is being affected. Patients taking amiodarone should have liver function tests performed regularly to monitor liver health and identify any changes as early as possible. In addition, it is essential that the use of this medication is always monitored by a cardiologist, who can adjust the dose or, if necessary, replace the medication with another safer alternative. If you use amiodarone and notice any unusual symptoms, see your doctor immediately. Your heart needs this treatment, but your liver health cannot be neglected. And the next drug on the list is even more surprising. It's used to treat gout, but it can seriously damage your liver. 7th, allopurinol, the relief for gout that can cost your liver health. Allopurinol is a drug widely used to treat gout and reduce uric acid levels in the body. It helps prevent painful crises caused by the accumulation of uric acid crystals in the joints, providing great relief for those suffering from this condition. However, few people know that allopurinol can also be harmful to the liver, especially when used without medical supervision. This drug works by inhibiting an enzyme responsible for the production of uric acid, but its metabolism in the body can generate toxic substances that directly affect liver cells. Liver toxicity caused by allopurinol can manifest itself in different ways. In some cases, a slight increase in liver enzymes may occur, which usually does not cause overt symptoms. However, in more severe situations, prolonged use can lead to drug hepatitis, which can cause extreme fatigue, nausea, jaundice, abdominal pain, and dark urine. People with pre-existing liver diseases, the elderly, and those who take other medications that require processing by the liver are more vulnerable to the side effects of allopurinol. In addition, severe allergic reactions to allopurinol can affect not only the liver, but also the kidneys and skin, making constant medical monitoring essential during treatment. If you use this medication, it is essential to perform periodic tests to assess liver function and ensure that your liver is not being harmed. Never increase the dose on your own, and if you notice any unusual symptoms, inform your doctor immediately. Allopurinol can be a great ally in the treatment of gout, but its use must be done responsibly to avoid serious complications. And stay tuned, because the next drug on the list is widely used to treat seizures and can carry serious risks to the liver. 6th, anticonvulsants, the seizure drugs that hide a serious risk. Anticonvulsants are essential for treating epilepsy and other neurological conditions, helping to prevent seizures and stabilize brain activity. Among the most used are phenytoin, valproic acid, carbamazepine, and lamotrigine. Despite their effectiveness, these drugs can have a serious and little-known side effect: liver toxicity. The liver is responsible for processing these substances, and in some cases, the metabolism of these drugs can generate toxic compounds that damage liver cells. Phenytoin and valproic acid, in particular, are the most at risk of causing drug hepatitis, especially in children and the elderly. Early signs of liver damage caused by anticonvulsants include severe fatigue, loss of appetite, nausea, vomiting, and pain in the upper right abdomen. In more severe cases, the patient may develop jaundice, characterized by yellowing of the skin and eyes, as well as darkening of the urine. Liver toxicity can manifest within a few weeks of starting treatment, or come on slowly over months. Therefore, doctors who prescribe anticonvulsants usually request regular tests to monitor liver function and detect any changes early. The risk of liver damage increases even more when these drugs are combined with other drugs that require intense liver metabolism, such as antidepressants or antibiotics. If you or someone close to you uses anticonvulsants, it is essential to strictly follow medical guidelines, avoid alcohol consumption, and perform periodic exams to protect liver health. Never stop using these remedies on your own, as this can cause dangerous seizures. And beware, the next drug on the list is widely used in the treatment of autoimmune diseases and cancer, but it can be a silent enemy of your liver. 5th, Methotrexate, a silent enemy for your liver. Methotrexate is a drug widely used to treat autoimmune diseases, such as rheumatoid arthritis and psoriasis, in addition to being one of the main drugs in the treatment of some types of cancer. Its effect occurs by inhibiting cell multiplication, reducing inflammation, and preventing the growth of cancer cells. However, this powerful remedy has a worrying side. It can cause serious damage to the liver. The liver toxicity of methotrexate can develop slowly and silently, making it an even greater risk for those who continuously use the medication. The liver is responsible for metabolizing this drug, and its prolonged use can lead to the accumulation of toxic substances in the organ, resulting in inflammation and liver fibrosis. Over time, if the damage is not detected and treated, it can develop into cirrhosis, an irreversible condition that severely compromises liver function. Early signs of liver toxicity include extreme fatigue, nausea, loss of appetite, and abdominal discomfort. In more severe cases, jaundice, swelling in the abdomen, and darkening of the urine may appear. Patients who are taking methotrexate for long-term use should have regular blood tests to monitor liver enzyme levels and detect any changes as early as possible. In addition, it is essential to avoid alcohol consumption during treatment, as the combination of methotrexate with alcoholic beverages can potentiate liver damage. If you take this medication and notice any unusual symptoms, see your doctor immediately. Methotrexate can be a great ally in the treatment of several diseases, but it must be administered carefully to avoid irreversible liver complications. And the next medication on the list may be in your cupboard right now. Antifungals are often used for common infections, but they can be a major risk to your liver. Fourth, antifungals, the cure for infections that can come with a high price. Antifungals are essential drugs to treat infections caused by fungi, such as candidiasis, skin mycoses, and more serious systemic infections. Among the most used are fluconazole, itraconazole, and ketoconazole, which are highly effective against several species of fungi. However, these medications can also cause serious liver damage, especially when used for prolonged periods or without proper medical monitoring. This happens because antifungals are metabolized by the liver, and during this process, they can generate toxic substances that harm liver cells. Continued use can lead to increased liver enzymes in the blood, a sign that the organ is overworked. Early symptoms of liver toxicity include excessive fatigue, loss of appetite, abdominal pain, and nausea. In more severe cases, the patient may develop jaundice, with yellowing of the skin and eyes, darkening of the urine, and pale stools, signs that the liver is failing. Oral antifungals are of particular concern to people who already have pre-existing liver disease or who are taking other medications that also put a strain on the liver. Therefore, long-term use of these medications should always be supervised by a doctor, and periodic liver function tests are recommended to detect any abnormalities as early as possible. If you need to treat a yeast infection, talk to your doctor about safer options or topical alternatives that aren't metabolized by the liver. While antifungals are extremely helpful, using them with caution is critical to avoid serious complications. And beware, the next drug on the list is commonly prescribed for blood pressure control, but it can be a hidden danger to your liver. Third, Methyldopa, the drug for hypertension that can cause irreversible damage. Methyldopa is one of the most traditional drugs in the treatment of high blood pressure and is often prescribed to pregnant women and people with high blood pressure resistant to other treatments. Because it is a drug considered safe in several situations, many people do not imagine that it can cause serious damage to the liver. The big problem with Methyldopa is that it can induce drug hepatitis, an inflammatory condition that compromises liver function and can progress to irreversible damage if not identified in time. Signs of Methyldopa-associated liver toxicity may appear weeks or even months after starting treatment. Early symptoms include intense fatigue, malaise, nausea, and loss of appetite. As liver damage progresses, the patient may develop jaundice with yellowing of the skin and eyes, as well as dark urine and whitish stools. Studies show that Methyldopa can provoke an immune reaction in the liver, where the immune system itself starts to attack liver cells. This can lead to a condition called drug-induced autoimmune hepatitis, which can be difficult to reverse. People who already have liver diseases, such as steatosis or viral hepatitis, are at an even higher risk of complications when using Methyldopa. Therefore, liver function tests should be performed regularly to monitor any changes. If you take Methyldopa and notice unusual symptoms, see a doctor immediately. Never stop the medication on your own, as uncontrolled hypertension can bring serious health risks, such as stroke and heart attack. The secret is to closely monitor the health of the liver and ensure that the treatment is safe. And stay tuned. The next drug on the list is used to treat psychiatric disorders and can be one of the biggest villains for the liver. Second, antipsychotics, the hidden danger in treatments for depression and psychosis. Antipsychotics are essential in the treatment of psychiatric disorders, such as schizophrenia, bipolar disorder, and resistant depression. Among the most prescribed are risperidone, quetiapine, and olanzapine, which help stabilize mood and reduce symptoms such as delusions and hallucinations. However, what many people don't know is that these medications can overload the liver and in some cases cause drug hepatitis. The liver toxicity of antipsychotics occurs because these drugs are metabolized in the liver before being eliminated by the body. If the liver is unable to process them properly, a buildup of toxic substances can occur, leading to liver inflammation. The problem can appear in the first weeks of use or develop over the years, silently. Initial symptoms include severe fatigue, nausea, loss of appetite, and abdominal discomfort. In more severe cases, there may be jaundice, characterized by yellowing of the skin and eyes, as well as dark urine and pale stools. Risperidone and quetiapine, in particular, can cause a specific type of damage called drug-induced cholestasis, which prevents the proper release of bile by the liver. People who take long-term antipsychotics should undergo periodic checkups to monitor liver function and avoid more serious complications, such as drug cirrhosis. If you use these medications and notice any warning symptoms, tell your doctor immediately. In some cases, it may be necessary to adjust the dose or replace the drug with an alternative that is less toxic to the liver. Antipsychotics are critical for mental health, but they need to be used carefully to prevent irreversible liver damage. And now we come to the first place on the list. The next drug is the most dangerous for the liver and the most consumed in the world. You may be taking this medicine without imagining the risks. First up, Acetaminophen, the bestseller that can be a fatal threat to your liver. Paracetamol is one of the most popular painkillers in the world, widely used to treat pain and fever. It can be easily found in any pharmacy and is considered safe when taken in the recommended doses. But behind this apparent harmlessness, there is a great danger. Paracetamol is the leading cause of drug-induced liver failure in the world. The risk arises when there is excessive consumption of the drug. The liver is responsible for processing paracetamol and transforming it into substances that can be eliminated by the body. But when the dose exceeds the safe limit, the liver produces a toxic metabolite called NAPQI, which can destroy your cells quickly. The problem is that many people take high doses without realizing it. For example, instead of taking a pill every 6 or 8 hours, some people take several doses in a short period to relieve pain faster. Others combine acetaminophen with other drugs that also contain the substance, unknowingly increasing the risk of liver toxicity. The first symptoms of acetaminophen poisoning may seem harmless: nausea, stomach pain, and general malaise. But within hours or days, liver damage can progress to acute liver failure, a potentially life-threatening condition that may require an urgent liver transplant. If you suspect that you have taken too high a dose of acetaminophen, seek medical attention immediately. There is an antidote called N-acetylcysteine, which can reverse toxicity if administered in time. Paracetamol can be an ally in pain relief, but it must be used responsibly to prevent irreversible damage to the liver. Now that you know the 13 most dangerous drugs for the liver, it's time to think about your health and make more conscious decisions. And in closing, an important message about how to protect this vital organ. Taking care of the liver is essential to maintain its health and quality of life. It is a silent organ that works tirelessly to eliminate toxins, metabolize medications, and ensure the balanced functioning of the body. But as we have seen, certain remedies can overwhelm you, and if we are not careful, the damage can be irreversible. The good news is that small actions can make a big difference. If you are on any medication on an ongoing basis, talk to your doctor about ways to protect your liver. Routine exams, dosage adjustments, and even dietary changes can help avoid complications. Also, avoid self-medication and never take doses above the recommended amount, even if it seems harmless. The liver has an incredible capacity for regeneration, but it also has a limit. And when this limit is exceeded, the consequences can be serious. So pay attention to your body's signals. If you notice excessive fatigue, yellowing skin, dark urine, or persistent abdominal pain, don't ignore it. They are alerts that something may be wrong, and the sooner you act, the greater the chances of recovery. Now that you know the risks of some medications, share that knowledge. Many people take these remedies without knowing the danger and can avoid serious problems only with the right information. Your liver is essential to your health, and protecting it is a choice only you can make. So, take good care of him, and he will continue to take care of you.